welcome to Biospaces The Weekly. Gilead continues its deal-making spree, swallowing Ouro medicines for around $2 billion. With its lead asset targeting autoimmune diseases, it's the latest headline in the sizzling hot space of I&I. Other news in this space this week includes J&J and partner Protagonist's new psoriasis approval and Sanofi's licensing deal with Cali. We'll also discuss a business update from Aurinia Pharmaceuticals, the company at the heart of the drama surrounding former CDER director George Tidmarsh's exit from the FDA. Meanwhile, the FDA is keeping us busy with new policies. This week, we break down draft guidance put out on the use of alternatives to animal models. We'll also touch on the confusion about the relatively new Commissioner's National Priority Voucher Program, as well as the most recent drama surrounding the CDC's Vaccine Advisory Committee. Let's dive in.
Hello, my one and only team member this week.
Yes. Yes, it's a quiet week. Well, quiet in the Biospace virtual office. Not
Right.
so quiet on the drug development front, although today was kind of manageable, which was nice.
I do feel like the world is giving us a little bit of a quieter week this week so we can survive without Annalise. She is off on her spring break with her family. So
Yeah.
I
Hear
appreciate
me
that.
knock
Thank
on
you,
wood
universe.
for you, Jeff. Well, yeah, it's been a little bit of a quiet week, but the week has a theme, which is the inflammation and immunology space. Or is it
That's
immunology
right.
and inflammation? I can never remember which I goes first.
I think it's immunology and inflammation, but you know
Yeah,
what? It's all
sounds
that
a little
stuff,
better.
autoimmune and all those. That really the space really has picked up in recent years. I think the theme last year was all about the movement of CAR T over to this space.
Right, and that still was touched on in a couple of these couple of notes I saw around some of these deals and investments, but we will get to that. So just so the rest of you know who we are, I am Heather McKenzie, senior editor at Biospace.
And I'm Jeff Axe, managing editor.
Yeah, so we will take you through all the I&I news as well as some other fun stuff this week. So yeah, let's start there. Well, we woke up this morning to a deal that had been percolating since last night. I like the percolating. I'm a coffee person, so
Yes.
um, that would and this would be Gilead's acquisition of Ouro medicines for just over $2 billion.
Yeah, that's right. So they're going to put down 1.675 billion upfront, but then there's up to 500 million in milestone payments. Gilead is hoping to share that cost with its longtime partner Galapagos. It said on Monday when it announced this news about the Ouro acquisition that it was also nearing an agreement that would see Galapagos shouldering 50% of that upfront and milestone payments. For those of you who don't remember, Gilead and Galapagos have been in a relationship since 2019. There has been a bit of drama around Galapagos. Last year, they announced they were going to have a spin-off company and split off their cell therapies, and then they abandoned those plans. So there's a lot going on with Galapagos. We've been following it closely. So I'll be curious to see how this potential deal with Gilead to collaborate on the Ouro pipeline works out. But back to Ouro. The lead candidate is a T cell engager that's currently in an early stage basket study for autoimmune diseases. Gilead CMO Dietmar Berger said that the pipeline that they're getting from Ouro really complements Gilead's existing inflammation pipeline, I should say. Inflammatory pipeline. Make it sound like
It's
it's an
inflammatory.
angry pipeline. um, and this deal really fits right in with what CEO Daniel O'Day had called a proactive and disciplined strategy to business development. So this follows on the $7.8 billion acquisition just last month of Arcellx, and that's bringing CAR Ts back into this discussion. So Gilead's gobbled up Arcellx last month and now is adding Ouro to the mix as well.
Yeah, I really like these deals when three or more companies work together, and it seems like this is what's happening here. It really seemed from a lot of the press releases, for one thing, from the companies, as well as the analyst notes that I read this morning. It really seemed like people are assuming this thing between Gilead and Galapagos is a done deal. So we'll have to see when that's finalized.
Yeah, it seems like it might work out. And then I'll be curious, like I said, to see how that might stabilize things at Galapagos. There was a lot of question about what this new CEO would do. Paul Stoffels left last year, and there's been a lot of question about how the company will move forward. So maybe this will help clarify some of that.
I really hope they stick around in some form because I love that name. I just love saying Galapagos, Galapagos gobbles, just gobbles up.
Right.
Well, Gilead was just par for the course this week, which seemed to be, as we have mentioned, all about I&I.
Right. So the other one I wanted to talk about was Protagonist in partnership with J&J. These two companies have been developing a treatment for plaque psoriasis that reached the finish line this past week. So the drug will be marketed as Icotide. Does that sound right to you, Heather? Icotide?
That's how I would pronounce it.
It's an IL-23 receptor blocker, and it is approved to treat plaque psoriasis. The approval came early and with a clean label, so analysts were thrilled with this. It's just another drug for J&J, but it's a first for a Protagonist. Right off the bat, Protagonist will receive a $50 million payment as a result of the approval, and they will now enjoy royalties from these sales as the drug hits the market. So pretty exciting for Protagonist and for the plaque psoriasis community in general.
Yeah, definitely. I like to see these milestones for companies. It's the first, you're right. It is just another drug for J&J, which has, I don't even know how many hundreds or something. But yeah, definitely very good for psoriasis patients as well. Well,
Right. And that
another,
transition,
yeah.
right. And that transition to a commercial stage company for Protagonist, those are always fun
Mhm.
transitions to watch.
Yeah. Well, another deal, Sanofi put down 180 million upfront to license a tri-specific T-cell engager from California-based Cali, which I'm only assuming is named after the state. Cali Therapeutics, that is. The asset has the potential to treat a broad range of B-cell mediated autoimmune diseases, and that's according to Cali. And Sanofi has been very active in the immunology space lately. They struck a deal with Sino Biopharmaceutical earlier this month, and Dren Bio and EVOQ Evoke
Evoc, maybe? Yeah.
Evoke Therapeutics last year. So yeah, they're definitely very active in this space.
They really are. Like I said, maybe it's a little bit of that observer bias. What's that bias where once you see something, you just see it all the time? But I feel
Yeah,
like I is in our news cycle every week now, whereas before it wasn't this active, and certainly not before 2024, 2025, at least to my awareness.
I think it's echo chamber. Is that, when
Maybe
you
that
keep
sounds
getting
right.
all the same news because you read certain news and then you get the same news, but that sounds worse than it is. But
Especially now with all these
yeah,
AI algorithms feeding us what we want to
yeah,
read, right? So I
yeah,
feel
they
like
are
there is a bit of an echo chamber there.
building our echo chambers that they're trapping us in. Well, even the drama this week had to do with the I&I space.
Yes, I'm excited to talk about this one. So, Aurinia Pharmaceuticals. For those of you who don't remember, let's take a little bit refresher on the background here. Last fall, George Tidmarsh, who was then the CEDAR director, called out Aurinia's approved lupus treatment, Lupkynis. Um, he said that the active ingredient had, quote, significant toxicity. And he also said that it, quote, had not been shown to provide a direct clinical benefit for patients. So he basically posted to LinkedIn saying that this was one that the FDA maybe shouldn't have approved. This company has a very important player, Kevin Tang. He's the president of Tang Capital Management and very well known in the biopharma space. This is an investment group that has made a name on offering an exit route to troubled biotechs. But he is directly connected to Aurinia. He's been on the board of directors there since 2024. So when George Tidmarsh posted this inflammatory post, no pun intended there with the inflammation, about Aurinia, Aurinia sued, but Tang himself complained to the FDA about this conduct. The FDA passed that off to the Office of the Inspector General, and Tidmarsh ended up under investigation for his personal conduct. And amid that investigation, he did exit the FDA. So it was, fit with this theme of FDA senior leadership turnover, but this one was a little bit different because there was a specific company involved and there was Kevin Tang involved, and it was all this drama. That was all last fall. Now, the new news this week is that Kevin Tang is taking over as CEO of Aurinia, and he's appointed several of his associates from Tang Capital Management to other key positions in the C-suite, and several members of the C-suite are now exiting the company. So I don't know if it's directly related to the drama that the company saw last year, but Tang like I said, he's, got a name in this space, and I'm very curious what his intention is taking over fully. This is absolutely one Annalee, I'm sure, would have more thoughts on if she was here. She follows him very closely. Um, but it is interesting to note that this is not completely out of the blue. This follows a year and a half of Tang Capital growing its stake in Aurinia. So back in September 2024, a year and a half ago, it was about 5%. And then by late last month, it was up to almost 10%, 9.2%. So maybe he's been planning something here. And again, I need to do a little bit more diving into this, but that's the update on Aurinia. A lot going on there.
Yeah, our staff writer Tristan Manalik even said when this news came out, he said, "Oh, Anna Lee would be all over this."
That's
So,
right. That's right.
and we all wanted to write it, but time is of the essence. But yeah, it follows another trend as well, which is, well, I mean, the history follows another trend, which is FDA leaders speaking out on social media and alluding to companies. The
Hmm.
same thing obviously happened with Commissioner Marty McCary and Unicure when everyone assumed that he was talking about Unicure a few
Right.
weeks ago.
Right.
Yeah. Well, uh, it's continuing with the drama. Last Thursday, Robert Malone, who is the vice chair of the CDC's Advisory Committee on Immunization Practices, he posted on social media on X that the committee was being disbanded.
Yeah, that was a surprise to see that.
Yeah. I mean, 5 hours later, he walked it back. However, so an FDA official quickly refuted this claim, and yeah, and then Malone kind of posted again saying, "Well, it was miscommunication, and quote, dissolving and reforming remains one of the options being considered after a legal decision came down regarding the committee's work a couple of weeks ago."
Yeah, so by way of background, this is the committee that Robert F. Kennedy Jr., the Secretary of the Health and Human Services Department, had totally revamped last year. We had a lot of coverage on this, and there have been a lot of questionable decisions coming out of this committee. This was also the committee that Susan Minera's former CDC director was she said Kennedy had asked her to pre-approve the ACIP recommendations, and that was kind of at the heart of why she left the CDC. And as a reminder, she was the only Senate-appointed CDC director in the past year, and we still don't have a permanent director there. So drama is the word here. Lots of drama around ACIP, but this particular turn of events really shocked me. I mean, if it's going to be disbanded, okay, that would be a surprise, especially since it's, got a lot of folks that Robert F. Kennedy himself has put in position. But to me, the most surprising part here was that the vice chair, Robert Malone himself, was the one putting out this news. And granted, it was just by social media, but a lot of official news has come by social media in the past year. So what's to say that this wasn't official news? In the follow-up from HHS, Andrew Nixon, the spokesperson who often corresponds with us, he wrote to us and he said, quote, unless officially announced by us, any assertions about what we are doing next is baseless speculation, end quote. That shocks me that it has to come directly from HHS and not the people working for HHS. So again, there's a communication problem here, to be sure.
I think there's a real identity question there. Who is us exactly?
Yeah, good question.
Well, this week in Clinica Space, I looked at another key policy that the FDA has come out with in the past year, and that is the Commissioner's National Priority Voucher Program. And last week, they actually announced that there will be a public meeting on June 12th to commission feedback from this program from stakeholders, which is excellent because they have a lot of feedback. So far, there have been 4 approvals and 1 rejection under the program, which unfortunately for disc medicine belongs to them. But the program has been criticized for a lack of transparency. Last month, Democratic Representative Jake Auchincloss, I knew I was going to mess that one up, said that the program is shrouded in secrecy. And I spoke with other experts a few weeks ago, actually, who told me that selection criteria for the program is not as standardized as they would like. And they also want to know who is making the selections. Well, the FDA earlier this year in January did put out a staff guide elucidating who the decision makers are and their roles. But clearly, these experts, regulatory experts, and industry folks would still like to see more detail.
Yeah, we definitely need more clarity around this program. This is the one that we've talked about in the past. Experts have told us as, a company, as an executive in the industry, do you even want one? Should you even apply? These are questions that companies are asking themselves. So without a little bit more information on the program, they're a little bit that's a hard question to answer. But hopefully, this public meeting coming up will give some answers. Hopefully, the FDA will take into account some of the feedback that they're getting, and maybe we'll have a more solid program that will have more support from the industry after this.
Yeah, because the people I spoke with, they even said, up front, well, this is fantastic. Getting drugs to the market faster it can only be a good thing. It's just kind of all the, how the sausage gets made, essentially.
Right.
Yeah. Well, speaking of guidance, the FDA also released draft guidance on animal testing alternatives last week. And this guidance is intended to help drug developers, sponsors, validate new approach methodologies, or more commonly called NAMs or NAMs, that have the potential to replace in vivo or animal testing. And so experts that Biospace spoke with in the past week have emphasized the FDA's recommendation around defining the regulatory purpose of these NAMs. So defining how to use them in the regulatory process. And one source, Certara's Kevin Snyder, suggested that a good use for NAMs right off the bat would be to explain the results of animal tests.
What does he mean by that?
Yeah, well, he said that companies could use these models to demonstrate that a safety signal seen in animal studies is specific to that species, and then that could overcome the FDA's concerns that that would translate to humans.
Yes, I've heard this before that NAMs aren't going to immediately replace animal testing, but
Mhm.
rather supplement it.
Yeah, and this is a consistent viewpoint to other experts as well. So
Yeah.
yeah. Um, well, looking at the newsletter that I curate, Clinica Space, came out on Monday, and there was a lot of good stuff in this one. I really like this edition. Bernie Ziprich, who lives with ALS and has founded a research effort to help accelerate R&D, he argues that what we really need in this disease space is a basket of targeted or precision drugs. So, in the emerging area of precision medicine, he said this becomes more difficult due to the funding gap between early research and drug development at the industry level. And he's arguing for congressional intervention.
Yeah, anything to help this patient population. I know you have a personal interest in this, Heather. I do as well. I wrote a book on ALS years ago that I was just really interested in. I got to know a lot of the patients in this space, and they desperately need options. This has been
Yeah.
like so many neurodiseases, but I feel like this one in particular really stalled in terms of progress. So if Congress can help, if Congress can provide that funding to help fill that gap, that would be amazing.
Yeah, I mean, they need options so much. The patients in your book, which by the way is excellent, check it out, everyone. We're trying to do it themselves.
Yeah, absolutely.
Yeah. Well, another excellent feature this week was looked at the increasing interest from companies like Lilly and Regeneron in using gene therapy to treat hearing loss. And it also looked at how those learnings and the momentum that this is creating can extend to other indications.
Yes, that one was a good one too. Definitely check that one out. This is another space we've been following closely, Regeneron in particular, with the big splashy news at I
Yeah,
think it was at ASGCD a couple of years ago. I still remember when that dropped. So I'm glad to have an update on what's going on here.
yeah, it's really cool. Well, Jeff, maybe you can sub in for Annalie on the biopharm exec front this week.
I sure can. Yeah, there's a lot in there. I won't go over it all, so definitely check it out. But the lead story this week is pretty interesting. It's about big pharma R&D spending. So the top 16 largest pharmaceutical companies spent almost $160 billion on research and development in 2025. But that's actually a 3.6% drop compared to the prior year where they spent 165 billion. So that's kind of an interesting trend. Check out the story to learn a little bit more there. And then I just wanted to throw out, and in case you missed it, from last week's BE, because it's just gone gangbusters on our site. It's getting a lot of traffic. And that's about the top company's revenue, right? So how much are they spending is this week, but last week we took a look at how much they were making. And J&J still reigns, but no surprise, Lilly has jumped up the list this year thanks to its GLP-1 offerings. So those are two great overviews of what big pharma is doing in terms of spending and earning.
Definitely. Check that one out. So, another in case you missed it, Biospace dropped our annual salary report this week. And among its many findings, our data show what most employers fear. Raises, especially those higher than 5%, are easier to come by if staffers switch companies. So check that out, and we'll see y'all next week.